What does anterior listhesis of L5 mean? Or another segment, what does anterior listhesis of L4 mean? Kind of the same question, different spinal segment, okay? In this episode of Ask Dr. Walter Sluro, I'm going to answer the question, what does anterior listhesis of L5 mean? Or what does anterior listhesis of L4 mean? Same question, different segment. Let's dive in, okay? First of all, what does anterior listhesis mean? Let's break this down. You may have heard of the word spondylolisthesis. You may have heard of the word retrolisthesis. So I'll kind of define them all. So spondylolisthesis means the vertebra moved, okay? So there's normal alignments of the vertebra and it either moved forward or backwards. So that's a spondylolisthesis. So forward or backwards. So it's a classification of a moved vertebra forward or backwards, okay? So it's a general classification. Oftentimes when you hear spondylolisthesis, it's usually referring to an anterior listhesis, but an anterior listhesis is specifically meaning that the vertebra slid forward, okay? So see that alignment right there? The vertebra slid forward. It should be here, and it's there. Retrolisthesis is when it slips backwards, okay? So anterior listhesis is when it goes forward. We're gonna talk about anterior listhesis. So is an anterior listhesis of L5 serious? Now L5, okay, so L5, right? It's lined up. I can't do it on this model because it's firm in this model, but when this comes forward, L5 on the sacrum comes forward, that's an anterior listhesis of L5, okay? Now, what happens when there's an anterior listhesis? Now, it could be caused from degenerative degeneration at the L5 causing that vertebra to slip forward. It can be caused from pars defects or pars fractures, okay? So those are two of the most common reasons. But what happens is, let me show you on this model, okay? So the L5 sits on the sacrum. So pretend that this is the sacrum. I know it's not the sacrum, okay? And let's say this is L5. So when it slips forward, first of all, these discs are normally attached to the vertebra right there, okay? So when it slips forward, you now have shear strain on the disc. That alone is going to cause issues, okay? The nerves that are in here are being stretched. That can cause pain as well. So inflammation and pain from the shear stress of the vertebra on the disc, damaging the disc, right? So that's pain generator. Now, the nerves are being stretched. Now that's being not just local pain possibly, but also radiculopathy, leg pain, numbness, and tingling, very, very common, okay? And then, of course, it's gonna stretch the actual posterior structures, which are the facet capsules, the muscles, the tendons that attach back here. It's gonna cause local pain there from the inflammation from the ligaments and the facet capsules, the stretching the muscles and tendons, distorting posture. So it's a big problem, okay? Now there's stable versions of this and there's unstable ones. Typically, if it's more than 50% of a slippage like that, more than 50% forward, it's can usually be a surgical consult. It may require surgical stability, okay? Usually if it's 25% and less than 50%, it's not gonna require surgery, but it's still very, very serious, okay? And those are assessments in terms of indication for surgery consultations, but you can have like an 8mm anterior listhesis or 10mm anterior listhesis, and every time the person bends forward or bends back, there's extra motion there. That's now segmental instability, segmental or abnormal motion, and that causes all sorts of issues and pain as well, okay? So the short answer is an anterior listhesis at L5 or an anterior listhesis at L4 is serious. It's definitely a pain generator. It needs to be corrected or needs to be stabilized, and that's some of the stuff that we work on in our office. There are techniques to help with that. Bare minimum, you want to at least support the structures around it, and to make sure it doesn't continue to progress, but you want to keep that stabilized. Other episodes. Here's today's question, and today's question comes from Carmen SM8. That's the YouTube handle, and this is what Carmen SM8 says. Do you have also a video with recommending exercises for degenerative spondylolisthesis, L405, grade 1, and what exercises are not recommended in this diagnosis? Best wishes. Thank you, Carmen SM8, for that question. It's a great question because I do see spondylolisthesis show up often in my office. But right now, let's talk about what exercises can be done with an L4, L5 spondylolisthesis. So keep in mind the vertebra slipped forward. It could be possibly unstable. How do you determine if it's unstable? You do flexion x-rays and extension x-rays. Okay, and now what it does is it stresses the vertebra and the vertebral motion, and we can see if there's more slippage in the flexed position compared to slippage in the extended position, and then compared to the neutral position. Okay, so When there's an anterior listhesis, we want to do exercises that does not aggravate or accentuate or make this worse, okay? So you can do exercises such as a posterior pelvic tilt, a seated posterior pelvic tilt. You'll see in some of my videos I talk about seated pelvic tilts. There's an anterior forward component and a posterior backward component. So you want to do the posterior backward component only because what that does is, so if you're sitting like this, you're doing the posterior component, it will help to stabilize that L4 spondylolisthesis. If you're doing the anterior one, you're gonna actually push that more forward, okay? So I recommend my patients to do a posterior pelvic tilt, okay? It can be done seated and it can also be done supine flat on your back, okay? So seated or supine flat on your back, posterior pelvic tilt. So those are two exercises. You can also do dead bug for abdominal strengthening and back strengthening. So you're on your back, dead bug position, and you can do the cross arm and leg motion of the dead bug, and also can do planks like prone plank safely to help stabilize the back and the core abdominal muscles. So those are some exercises that would be warranted for a spondylolisthesis that's anterior listhesis at L4, L5, and also of course at L5S1. Some things to avoid. So I would want to avoid the anterior pelvic tilt, okay? So if you're tilting anterior, you're gonna accentuate the lumbar lordosis and cause this to slip forward more, okay? So avoid anterior pelvic tilt and avoid any lumbar extension type exercise like prone extension or full arm extension, and avoid things like Superman, which also extends the lumbar spine, okay? So either things that are neutral with the back, like planks, dead bug, or anything that will help promote a posterior movement to stabilize that lumbar area, okay? So if you've missed some of the past episodes, do go right there. You see that playlist right there? And you can click on the playlist. You can watch them all from 1 to today, and you can also pick and choose the ones that you want to watch as well.